Hello, everyone. We'll go ahead and get started. I'd first like to introduce myself. My name is Po-Lian Lim, and I will be the moderator for this evening. I am an infectious disease and public health physician working at the National Center for Infectious Diseases and lead for biorisk management at the Asia Center for Health Security. And it's my privilege to introduce our speaker for this evening. Um, Dr. Oliver Morgan is joining us. He's actually in Singapore, but he currently is the director for the WHO hub in Berlin. Um, and he hails from London and had done his PhD at Imperial. He's an epidemiologist by background. Um, he worked with the UK Health Protection Agency from 2002 to 2007, then joined the US Centers for Disease Control and Prevention from 2007 to 2016. So he spent part of that time with the Ebola response in Sierra Leone as a country incident manager, and then joined the WHO from 2016 onwards. So one of his major areas of interest and expertise is in the field of pandemic and epidemic intelligence. And he has conducted a lot of epidemiologic investigations for ID outbreaks, radiation and chemical exposure incidents, natural disasters, and complex emergencies. So one of the challenges that Oliver has been working on with WHO is the use of novel and emerging technologies and digital technologies for epidemic intelligence. So it is our privilege to have him speak with us today from Singapore, actually. He's been visiting us at the National University of Singapore, Soswi Hawk School of Public Health. So Oliver, please go ahead. Welcome.
Great. Thank you so much. And it's such a great pleasure to be with you today for this presentation. I'll bring up my slides and just to make sure that we can see them okay. I'll put them into, can I just check with you, Pulian, that we can see it okay?
Yes, that looks great.
Great. Thank you so much. Well, fantastic to be with you and to share some insights into some of the kind of leading edge use of innovations in the digital space for public health intelligence. And I'll stray a little bit outside of the digital space into, some of the genomic space as well, because in reality, a lot of pathogen genomics is actually about bioinformatics. And a lot of the exciting stuff is happening in that realm as well. So what I thought I would do is to really kind of give you a grounding in what is public health intelligence, why is it different from surveillance, and then kind of get into why and how digital tools are driving innovations in this space. And I think all of you will recognize these two images of Jon Snow, all the way going back to 1854. And really, this was in many ways considered the beginning of contemporary epidemiology, or epidemiology full stop, I guess. His seminal outbreak investigation really laid the foundations for what was to become the investigation of outbreaks. But perhaps surveillance itself could be more truly attributed to this gentleman, William Farr, who was just a little bit earlier than Jon Snow. And also in England, William Farr really started the practice of collecting national statistics or vital statistics, particularly around causes of death. And he was particularly interested in some of the sociological factors that were driving different causes of death and also premature death. And he set up the first really robust system of mortality surveillance, which really, I think, is the foundation of all surveillance, even to today. So really, these are our foundations. But it was Alexander Langmuir from the United States who really, I think, brought surveillance into the modern era. And he was the chief epidemiologist at CDC, starting in the 1949 all the way through to 1970. And he was really a titan of surveillance and epidemiology. And He really combined the use of disease surveillance and rapid field investigations to drive decision-making for disease control. And actually, it was him who coined the term epidemic intelligence, because he considered the use of information as an intelligence function, which was really driving how outbreaks could be controlled. And so really, I think we hit a turning point in this era about how surveillance was conducted, moving towards a broader concept of wide intelligence gathering. Another really important milestone, quite a number of years later, was in 1994. And this was the establishment of a surveillance platform called ProMed, which still exists today. It still runs today. And ProMed was established by these three individuals back in 94. You can see a 1994 era kind of photograph here. And these three individuals, Stephen Morse, Jack Woodall, and Barbara Hatch Rosenberg, they used what at the time was a brand new technology, which was email. And they realized that through email, they could connect with people all around the world almost instantaneously. And they set up a global network of disease specialists, clinicians, microbiologists, virologists, who would share information via email of events that were happening. So this was really critically important for a couple of reasons. Not only did they use technology to connect people directly all around the world, but maybe more subtly, they were able to create a system of surveillance that wasn't a government-run surveillance system. This was what we would consider today something like crowdsourcing, and they were able to generate, let's say, an independent source of surveillance intelligence about events from real experts on the ground who could see what was happening. So this was really, really a massive development in public health intelligence. Of course, you know, at the same time, WHO established really this year its own public health intelligence unit, really in response to a large outbreak of plague in India, which really went unchecked. And then there was really mass panic, which actually stopped travel to and from India for quite a period of time. And WHO realized that it couldn't continue with the old style of surveillance, which was really kind of a slow compilation of case counts, and realized it needed a faster way to understand what was happening in the world. So at the same time, WHO also tries to upgrade its surveillance functions to an intelligence function to learn what is happening as quickly as they can. Of course, quickly after email, or really at the same time, but in a kind of similar period of digital innovation, we had the growth of the internet. And with the internet, again, a whole lot of new information became publicly available. And that was used from 1997 to create what was called the Global Public Health Intelligence Network, which was an initiative between WHO and the government of Canada to look around the internet, which was much, much smaller in those days, to understand if there were reports of disease from different countries, and to use this as an early warning mechanism or an intelligence mechanism to understand where they should be directing their investigations. And so this, I think, is probably where the modern era of current epidemic intelligence starts. And we saw in the intervening years a number of other initiatives in a similar kind of with a similar kind of idea. We have the European Media Monitor in 2002, Health Map in 2006. Both of these initiatives actually are still running. And interestingly, both of those are run by non-governmental entities. So again, this trend of supplementing national surveillance systems with these international intelligence mechanisms. And then we have a little bit later here in 2001, an initiative which I think probably nobody here will have heard of. And that's because it was only available to a very small number of countries, which was called the Global Health Security Initiative. And there were 8 countries involved. The European Commission and WHO were also participants in this initiative. And they built another generation of epidemic intelligence systems called early alert and response. And that was really, I think, the state-of-the-art platform, but only available to a handful of countries and a handful of analysts. So this is why very few people have perhaps heard of this system. Moving forward to 2017, actually, when I joined WHO, we had a conversation with the Global Health Security Initiative and effectively negotiated a handover of that platform to WHO with the goal of democratizing this technology and making it not only more available, but also more functional. And the current initiative is called Epidemic Intelligence from Open Sources. And you see on the right-hand side this bar graph, which shows the growth of the initiative with actually, it's hard to keep this graph up to date because we keep on adding countries, but actually there are about 106, 107 countries now using this epidemic intelligence platform, as well as about 30 or so international organizations. And this is a really interesting initiative because not only does it provide a huge amount of information, it's curated information. It's not just random information off the internet. These are curated sources. We have about 50,000 sources that feed into the platform at the moment. And every time a new country joins the platform, we go through a process of curating new data sources specific to that country and then adding them into the platform. So we have a kind of continuous growth of data sources which are specific to all of the countries participating. I'm going to come back and talk about some of the kind of more leading edge digital innovations here. But I just wanted to flag this as one of the initiatives that's currently, I think, got the largest coverage for epidemic intelligence. And then it's not often I get to talk exactly about the future, but there is actually a new initiative just about to be launched. The launch event is on Thursday, actually. Unfortunately, at a time that's none of us, I think, here in Singapore will be awake, I don't think. But this initiative is called Beacon, the Biothreat Emergence Analysis and Communications Network. It's hosted out of Boston University. And it's going to be a new intelligence platform which will use, I think, a novel combination of human reporting from the ground, a bit like ProMed, but also some artificial intelligence, a bit like EIOS. And I think this will be available to a much wider range of users as well. So that's that's a quick history, a quick overview of where we're coming from along this journey. And so I'm going to turn now a little bit to thinking about, where are the innovations and how are innovations being driven. And I seem to have, one moment, my slides seem to have frozen. Let me see if I can get out of my slides. Are you still able to see my slides?
We only see the emerging challenges for public health intelligence. It's not advancing.
Let me see. Let me stop sharing and restart if that's right. I'm sorry about that. How about now? Is that okay?
Still the same slide. Oh,
Yes.
there we go.
Here we go. So now getting into really the heart of the talk today, which is around why are digital innovations not just interesting and fun, but really important. And it's because inherently, when we're thinking about surveillance or intelligence, we're trying to manage huge amounts of uncertainty. So before a pandemic or epidemic, there's obvious uncertainty about what the pathogen might be, something that we know, something we don't know, where it might occur or where we might detect it first, when it might happen, of course, and what the severity of that disease might be. And then once a pandemic or epidemic event starts, there are another set of uncertainties that unfold. And of course, we experienced this certainly during COVID-19, but questions all along the journey from the beginning of the epidemic event through to the end, such as, how do we manage it? Are our health facilities coping? Do we have an effective vaccine? Are there new variants emerging? And so on and so forth. So we need these intelligence mechanisms to really try and manage this uncertainty. And so we can't plan specifically for an unknown pathogen, but we can plan for managing this uncertainty. Now, one of the maybe obvious things now for coming through the pandemic was the multi-dimensionality of pandemic and epidemic risks, which of course makes it very difficult because it's not just about classical epidemiological surveillance of cases and deaths, but really it's about this complex interplay between the economy, the environment, the underlying health profile of the population, social dimensions, as well as any public health interventions that we choose to implement. All of these will affect the disease dynamics of any outbreak, actually. And trying to disentangle that and trying to create a framework for decision making is extremely difficult. Here is a really great paper by Mark Lipsitch trying to do exactly that, work starting from decision points and then thinking through what type of evidence would be needed, what type of surveillance inputs could be used for that evidence, and tracing that back all the way up to what is going to be needed in terms of people, processes, and technologies. So you can see a kind of linear kind of thought, but to a very non-linear process. And so you can inherently kind of, I guess, appreciate some of the challenges that we face in this space. Another opportunity, but also another challenge, is that there is so much innovation happening. I think for many years, public health surveillance itself remained kind of changing in a fairly slow basis, kind of incrementally. But now we have this innovation in laboratory science and innovation in data science that's really driving huge innovations in public health intelligence and surveillance. And this slide is really for illustration. On the left-hand side, it's the number of member states who are able to sequence SARS-CoV-2. And on the right-hand side, the number of GitHub repositories for COVID-19. And you can see that these dates are kind of old, but it gives a good illustration of the explosion of innovation and the information that comes with it that we now need to manage. So how are we going about managing all of this exciting but challenging environment? Well, I wanted to talk just a little bit about the hub which I lead, which is the WHO Hub for Pandemic and Epidemic Intelligence, because we were created specifically for this purpose, to manage and understand these innovations and try and help translate those into practical tools for day-to-day public health departments. We were launched in 2021 and opened our doors in 2022. We got ourselves up and running in 23, and since 2024, we've had a full team and a full portfolio of work, some of which I'll discuss now in this, but there's clearly many other things that we do, which I can't cover in such a brief presentation. Some of the aspects which are particularly interesting is that we've put a lot of effort into actual physical convenings, bringing people together, because at the heart of all of the innovation and the translation of that innovation are people, of course. So we've had about 3,500 people participating in a range of activities over the last 2 years in Berlin and other meetings around the world. We have a number of regional partnerships and networks, again, at the global level, and a number of institutional agreements. And this is really a platform for innovation. So I think it's important when we think about digital technologies that we don't just think about the technology, of course, but we think about the social underpinnings behind those technologies for them to be used. And inherently, these are kind of social underpinnings, and we have a professional social network, and we work very hard in the hub on the collaboration aspects, as well as the technology and the digital as well. So maybe I'll leave that message here for you to consider, that it's not just about the tech, it's about how you kind of socialize the tech and you involve other people as you develop that technology as well. Maybe a couple of small points about the way that we do business. We're not a tech startup, but we're also not a traditional kind of international organization office either. We have a very interesting workforce where half of our workforce are not staff, but people who are in Berlin on secondments, academic partners, different types of consultants, visiting fellows. We have a number of academic fellowships too that we're supporting. And it's really a melting pot for people to come and work together on a number of projects, either over a long-term basis or on short sprints, and taking those results back to their home countries. So let me come to some of the digital innovations that we've been working on, and give you a flavor of some of the directions that we're heading in. So you might recall I spoke about the Epidemic Intelligence from Open Sources platform, which is now used by over half of member states around the world. And we've been working really hard over the last couple of years to re-architect that platform, largely to enable different partners to develop modules that can plug into the platform, so that it's not a single effort to develop the kind of digital environment, but that we can crowdsource some of the development. And here are some, on the right-hand side, some of the things that we're working on around better anomaly detection, semantic search. We have a speech-to-text project, which I'll mention in a minute. Reducing noise is a big challenge. I mean, we have really millions of bits of information that come in through the platform, and a lot of it is not useful. So we have to sift through that and reduce the amount of noise to pick out good signals. We have different kind of machine learning approaches for what's called abstractive summarization. So we can take lots of different pieces of information and summarize that automatically. It doesn't need to be done by a human. Different types of scraping from online sources, as well as some work in the background around categorization and ontologies as well. So the speech-to-text feature in the EIOS is particularly interesting because a lot of people still receive information primarily through radio. And what we're trying to do here is get as close to the local news generation as possible. And actually, local media outlets is a great source for detecting unusual events quite quickly, but obviously not everywhere has either print or digital news outlets. And so radio broadcasting is something that's still used a lot around the world. And we've had this project that's now coming into production to take radio signals and basically transcribe them, tag them, and then make them usable within the EIOS system. So here's just a screenshot of the particular interface for the platform 2 of EIOS, and you can pick out radio broadcasts and interrogate some of the information that's coming out of radio broadcasts. We're also interested in different ways of searching information. So we're using a technology that's quite well used now across search engines like Google, which is semantic search. And semantic search allows us to, if I just quickly run this animation, really allows us to start interrogating the information that we have in a much more natural way. Again, you'll be familiar with this, obviously, from using other interfaces, which natural language type interfaces like ChatGPT and others. And it allows the searching to be much more sophisticated than just a kind of a filter type search, which we've had until quite recently. So we can also do this in a number of different languages as well. And so this really is adding quite a lot to the way that we can interrogate data. Moving even beyond that, we've started to explore technologies which were simply not accessible to us 3 or 4 years ago, even, such as using agentic AI to create different data structures, such as a graph data structure, to be able to look at different types of information in a completely different way. So this can potentially unlock all sorts of insights from the data that we have, And this is a kind of new and evolving area, certainly for us in public health. We have an animation which I think I'll leave for the sake of time, but that's just to say that we're now able to restructure the data in different ways, which really will unlock new insights. I mentioned pathogen genomics, which is a large part of pathogen genomics is actually bioinformatics. And so we're working through a platform that we've created called the International Pathogen Surveillance Network, which really builds large communities of practice all around the world to work on pathogen genomics. I actually chair the community of practice for pathogen genomics data, which includes all sorts of interesting topics about not just the generation of those data, but the governance of those data, and also how to analyze those data. And it's a very fast-moving field. Even pathogen genomics and an analysis of pathogen genomics has changed in the last 2 years. So what we do now is a bit different from what we did even 3 or 4 years ago. And there are many different aspects to this. This is just a quick snapshot of some of the work that we're doing within the International Pathogen Surveillance Network, creating a whole lot of different toolkits and functional kind of tools for users. Some we create ourselves as WHO, but actually you can see quite a lot are driven by partners. And again, this is the approach of using the WHO platform to work with partners who are generating their own tools and allow wider dissemination of those tools and more rapid adoption. So the moving on for yet another type of approach that we're using a digital innovation for is that we're trying to fix some, let's say, old kind of traditional practices about how we manage information during emergency responses. And at the moment, a lot of that information management within an incident management system is quite manually based. And so we have a lot of data around pre-crisis baselines in countries. There's a lot of technical guidance out there, and lots of different types of workflows and templates, all that get used and kind of pulled into an incident management system. But it then consumes a lot of staff time to work with all of that. With our colleagues in the Eastern Mediterranean Regional Office of WHO, we've actually been working on approaches to automatically generate a lot of the informational products that we need within an incident management system. So this is just for illustration, an AI-generated template of a rapid risk assessment for cholera in Lebanon. It takes about less than a minute to generate some of these assessments. Of course, the AI generated text needs to be carefully read and validated, so it doesn't the job isn't over after a couple of minutes. But normally this would take several hours, maybe 10, 20 hours of work to pull all of these data together. So by having better curated data with some AI functionality is allowing us to really speed up a lot of the work that we do within an incident management system as well. Understanding the data that we already have, again, is another theme I think that the digital innovation is supporting us with in terms of public health intelligence. And so one of the challenges I think that we have is that while we do sit on a lot of data, so IDSR is an integrated disease surveillance and response surveillance network across Africa. It collects data every week from every single country in the WHO African region. But analyzing those data is not so easy, and they have some static dashboards, but it's not very informative. And we've been exploring ways of using AI to provide a natural language interface that allows querying the data just through typing in what you're interested in looking at. And this is a kind of a neat project because the way it works is it actually generates SQL queries that get then passed to an SQL database which is not connected to the AI engine at all. And then it passes the outcome of that SQL query back into a separate interface. So we're being able to use some AI, but keep the data private at the same time. And so we're not having to upload any confidential information into an AI platform that's not controlled by any of the member states. So kind of moving kind of towards the end of the presentation, but just a couple of further reflections about some of the innovations that we've been working on and thinking about is how do we combine the best available data that's out there with the right analytics and then communicate that in a timely way. And of course, this is way more challenging than it might seem on the surface, especially once you get very complex environments with many different countries involved, or very large events where you have even multiple regions affected. And we also have to have challenges in whether we have enough in-house capacity, whether it's WHO or any other organization, as a matter of fact, whether there's enough in-house capacity to do all these analysis. And then sometimes we see that some of the analysis is being done with people maybe who might not be aware of some of the operational realities or the context where the events are happening. And then, of course, communicating some of this to decision makers is very difficult, and the interaction between decision makers and analysts can be particularly challenging. So we've created what's called a collaboratory, which is a laboratory for collaboration, which allows a range of different people from around the world to interact with each other on a real-time basis. It's actually a platform that's created through adapting both Discord and GitHub. And we have 17 communities of practice that are working together from all around the world on a number of topics. And again, this is a form of crowdsourcing analytic capabilities that has happened on a small scale and on an ad hoc basis for past emergencies or past outbreaks. But now we're trying to bring this into a more systematic, onto a more systematic basis. And we have a range of different areas of focus. For example, mpox analytics. Here are some of the kind of questions that we've been working with this global community on, like how do we estimate the size of mpox outbreaks in DRC from cases detected abroad, for example, or dengue analytics. It's another area where there's been this crowdsourced approach about how to predict the number of dengue cases in 3 months from surveillance and climate data at the same time. Things that are possible, but and people have done in research context, but maybe not so easy to do on a routine basis. And then we also have a really exciting project, which is the Global Repository of Epidemiological Parameters. And the epidemiological parameters is really about how we estimate, how we can gather existing parameter estimates from different outbreaks and be able to access those rapidly and easily for future outbreaks as well. Just in the last minute or two, we're trying to package all of these things into more accessible interfaces, particularly for decision makers. And here we have an initiative called Decision Support Pandemic Simulator, which is a simulation environment. It's still in a kind of prototype phase, but it allows decision makers to zoom in on particular communities and run scenarios with multiple interventions and test out interventions in a kind of a simulated environment to aid their decision making about how to go about controlling outbreaks. So this can be done already, but again, it's usually done in a fairly static way or a one-shot type of approach. But we're working on this environment that allows decision makers to access this on a kind of iterative way. And this is really my a final slide here, which is about the fact that that process itself also is can be really enhanced by using some of this evolving AI technology and being able to iterate around different decisions as decision makers discuss and deliberate on an unfolding event is currently not that possible. You can, even where there are groups of models that work with decision makers, the kind of iterative process might take too long. And then by the time you get an answer for a question about whether certain interventions can be used, the epidemic is moved on and then it's kind of a bit obsolete. So there may be opportunities for using different types of AI to make that feedback loop much faster, and also combining simulated scenarios along with real-time data to start kind of pre-training some AI models in real time as we go forwards. And I put a link to a paper that we just published looking at some of these different approaches that we think can be used probably in the near future, but haven't been applied yet. So just as I wrap up, my last thoughts that I want to leave with you all is to try and bring us a little bit back down to earth. So there is a lot of exciting digital technology out there. We're working hard to try and use that in a creative way in existing public health surveillance and intelligence processes. But however clever we get with the digital technology, at the end of the day, we still have to have people on the ground who investigate outbreaks, whether they're individuals like in this photo who are contact tracers in DRC, or whether they're clinicians, astute clinicians identifying cases from their clinics. In the end, outbreak detection and response is inherently a field or on the ground type of response. So the digital work is super important, but I did want to end my talk just to acknowledge and recognize that behind every great digital innovation, there needs to be great people in the field working with communities and with patients. With that, I'm going to stop sharing my slides and hand back over to the chair. Thank you very much.